All right, continuing with this energy, we are back. So we are doing the ChiroThon 2026 here in Kansas City, where we're going to be hosting FIFA, doing a lot of cool things with the foundation. So keep going.
Absolutely. If you're going to watch FIFA, make sure you do not miss the game in Kansas City, because we're here right now. We're starting the energy. We've had an amazing day so far with so many incredible guests. But remember to watch the vignettes and donate to help us reach our goal. You can visit f4cp.org/ChiroThon.
And go ahead and say it again so it rhymes.
Yes, f4cp.org/Chirothon.
There you go. And speaking of our donations, we are we're past halfway now. So we just hit 17,459. Now, I'm going to challenge you. Let's hit 30,000 today, so that way we can go over tomorrow and almost hit that 60,000 goal that I set. But our big goal for the weekend was 30K. I'm raising it to 60, so don't forget, every donation, you'll be entered to win that gift basket of the Adjusted Reality.
Absolutely. Adjusted Reality. Now, this weekend is all about supporting a powerful cause. How do we help people that are hurting? How do we get the message across the globe? How do we set a safe, drug-free option for whole being care? Well, if you know someone who is looking for a healthcare solution that really doesn't include drugs or surgery, you can visit f4cp.org/find-a-doctor.
We couldn't have made this any, sorry, these allergies are kicking my butt. But anyways, we could not have made this possible without our sponsors, and I can tell you this right now. Thank you to all of them, but this one's specifically about Biotics. Biotics Research has been a leader in the nutrition industry for 50 years, known for top quality supplements and enhanced product delivery systems. They drive an advancement by focusing on research initiatives, unique product formulations, and unprecedented quality control. They're family owned, which I always love in business, with a rich history and the most proud of their valued partnerships with healthcare professionals. Let's go ahead and see what they're all about.
Hi, my name is Dennis DeLuca, the president of Biotics Research. In the late 1950s, my cousin was diagnosed with a serious illness, and my father became determined to help him. The prognosis was not good, but through science-based nutritional intervention, my cousin's quality of life exceeded medical expectations. It was that illness that brought several family members together, which led to the founding of Biotics Research in 1976.
All right, everyone, we're absolutely excited to introduce Dr. Rebekah Wilks. Now, she's not only a rock star in chiropractic, but she is really one of the favorite people that I've had in my life for the last 10 years. Dr. Rebekah Wilks is a global health strategy professional. She is working at the intersection of policy, clinical practice, and international collaboration, and as the Director of Strategy and Policy for the World Federation of Chiropractic. She takes things global. She supports the World Federation of Chiropractic Secretary General in the development, and I love this word, the alignment of global strategy across the member and national chiropractic associations. Now, she is here to advance a shared vision that all people of all ages in all nations have access to chiropractic care.
Let's go.
Her work connects the profession to broader global health efforts, including engagement with the World Health Organization ecosystem, and importantly, the World Rehabilitation Alliance, where she leads rehabilitation workforce priorities. She also serves, if you're not already tired by how much work she has, as the project lead and co-chair for the World Spine Day, and we support that. That's the largest global public health campaign dedicated to spinal health. Dr. Wilks' career reflects a consistent trajectory to leadership across healthcare, government, and academia, including early experiences with the White House and the United States Senate. Now, she currently serves as a clinician within the U.S. Department of Veteran Affairs, practicing in the interdisciplinary environment while actually mentoring, which we really need, is the future providers. Known for connecting vision with action, she is absolutely committed to strengthening global collaboration. That's really the key for the role of chiropractic in inspiring the next generation of chiropractors to shape their entire future for whole being, patient-centered care. So welcome with us and thank you. I know you're really busy, so we want to get right to it because there's a lot to ask. And oftentimes when we think about global opportunities, we really don't recognize the impact that happens around the world. Can you share with us a little bit about the World Spine Day and what that means and who's being impacted.
So World Spine Day is the world's largest global public health awareness campaign on spinal health and well-being. So that means when we say the world's largest campaign, we've done the numbers, and we've actually looked at people who support World Spine Day, people who have actually been exposed to World Spine Day through bus campaigns, through television, through radio, through private clinicians, community events, and over 1 billion people worldwide have actually had exposure to World Spine Day. So what we do is try to empower both the patient, we also try to empower the clinician. So within the patient realm, we make accessible, motivational type of messaging. We translate research into action with these patients. And it goes into like the lower middle income countries where there are not a lot of providers. And within this space, there's usually somebody with a smartphone. And so we try to translate that to them. But we also empower clinicians to be able to share our messages and to be able to, they don't even have to make a message, they just share our message. But we also build up through the year with a campaign. So as instead of just having World Spine Day, we actually have different types of educational pieces throughout the entire year so they can build up to their own World Spine Day to create awareness around spinal health.
So critical. So,
yeah.
And especially when you're thinking about and you want to support organizations that really do help people that are suffering with these types of disabilities. You know, low back pain really impacts how you carry out your activities of daily living. And when your activities of daily living depend on actually thriving and living, and you can't do the job that you need to do, I mean, everything stops from there. I think that's a critical component.
No, I would agree. And I think another thing too is that when we look globally, there's a lot of people that don't have access right now, right?
Right.
Like we're growing, and I was WCS, World Congress of Chiropractic students, and one of the things that I always loved is meeting the kids that were trying to take it to the world. And looking at my classmates who've gone overseas, right? And it's not always easy. You know, they don't know what chiropractic is in some of these countries, and you're bringing it to them for the first time. And what I've always loved about World Spine Day is that the exercises, its simplicity, is teaching the concept, the philosophy of why your spine's important. Not just saying, hey, this is chiropractic. It's like, no, you are a nervous system. You do need to be balanced. You do need to be healthy. And that's one of the things that I think is so important.
So when you think about World Spine Day and being in chiropractic school, what were some of the things that you thought of as reaching out across the ponds of so many different healthcare providers? Because it's chiropractic, but it's so much more. Tell me some of the experiences that kind of surprised you when you started helping others that weren't necessarily North American based, that you thought, wow, I'm really fortunate to be able to help this population.
With the context of World Spine Day, just seeing the World Federation of Chiropractic has a global competition every year. And so they award both associations, national associations. They also award private clinicians. They award educational institutions and students. And so I was able to see these competition entries for the very first time. And you have this large community event in Ghana that is that's speaking to all of the workforce within a specific sector there. And they were able to show them different ways to lift, different ways to move, and different ways to prevent workforce injury moving forward. So being able to see all of this from the more of the looking at the patient perspective, it was phenomenal. But also translating to the interprofessional nature of World Spine Day. When I was at the World Health Organization for the World Rehabilitation Alliance launch, I was able to start conversations with people, and it wasn't just based off of, hi, I'm a chiropractor. It was more like, hey, I've got this initiative. It's a World Spine Day, and we really go towards empowering the patient to be able to be more functional and to be able to prevent instead of be proactive, instead of reactive. And so a lot of these individuals got on board with this, including this year Cochrane gave us a shout out. And
Fantastic.
This was from one of those conversations, just talking about World Spine Day. So being able to see how this impacts other fields, how they embrace it, being able to see how other cultures are able to motivate the society around just spinal health, and when there's many not access to the providers like you referenced. So it's very heartwarming to see just the reach of World Spine Day.
Yes.
With what you're involved in, obviously there's a lot of different initiatives and groups and panels and organizations. So often chiropractic's looked at as pain, right? Like, oh, you're going to chiropractic because you're in pain. Talk to me about the broader approach that these initiatives are taking, going beyond pain.
So when we look at pain, if we look in the sports context, I mean, it's very important within injury. It's very important within trying to return to play. But you zoom out to the population context and you look at it as it is trying to return to taking out the trash. It is trying to return to putting on your shoes. So you look at the general population, and then you look at the global burden of disease studies, and you see that musculoskeletal conditions are the highest in the world. You look at low back pain being the #1 within the global years lived with disability. And so you see pain as a very big thing. But when you zoom out to more of the global picture and you want to look at their dialogue, you look at first the WHO definition of pain, or WHO definition of health. And what is that? It is a complete mental, physical, and societal sense of well-being, not just the absence of disease.
Yes.
And so you want to see what they're talking about within this context. And you can look at various initiatives they have going on. One of those is the economics of health for all. And what is that? That's the finance sector. And so upcoming within the World Health Assembly that is coming up, that WFC has a delegation of about 6 individuals. That's their max for us to go. And we are going to be within some of these conversations. And you look at the economics of health for all, and they're looking at measuring the system by health. So no longer looking at productivity, but looking at well-being, looking at engagement in society, looking at equity. They're no longer looking at certain numbers of just, okay, what is the investment in the healthcare system? What's the cost? Now they're looking at long-term investment on societal health, and now how that actually invests into the system and saves money. So you look at those pieces, you look at the World Rehabilitation Alliance and how they are advocating for function as the third indicator of health, aside morbidity and mortality. And you also look at other initiatives such as the family of international classifications. So when you look at that family, we've all heard of ICD-10. That's one of those. But they're also looking at the ICF, which is the International Classification of Functioning Disability and Health. So we had a delegate from the WFC that went to the Family of International Classifications meeting. They wanted us to be there. And so we were talking about how can we incorporate what we do every single day, health, prevention, how can we increase function and go within that sphere. And so when you look at pain from a global level, really it's not pain, we're looking at health. And we're really looking at increased functionality as we go through these spaces.
So are we discussing nervous system within this conversation with these different initiatives of understanding how the adjustment actually affects the nervous system, which helps that whole healthy whole being?
When you're in the global realm, they like to be what's called professionally agnostic. So they don't go into how this functions. They go into what do we see. We know we increase function. So they use the word function to be able to make people live and move and thrive in the way that they should.
Cool.
They don't go into the depths of, well, how does the nervous system work? How does an adjustment
But that
work?
is being stated now, right? Instead of just saying, oh, it's just pain related, we're looking at whole body function of the body now.
Yes.
Okay, which I think is amazing.
It is really exciting to hear you say this, because when you come into the international classification of function, that's different than disease. And that's where I think people need to recognize that the framework is shifting to see how people are able to carry out their life, that longevity, if we will, to really correspond with where they are in equity of healthcare, which can be a variety of different things from the World Health Organization, because where you are, the zip code for just North America can add 20 years to your life. That's phenomenal. Where you live in North America can really maximize or minimize your whole being care.
Social determinants of health.
That's exactly right.
So, yeah.
So let's talk about the coding system. We want to move away from disease care treatment towards prevention and proactive care. What would you see the future to be in that as you're starting to have these conversations about that on a world scale?
They are looking to develop this ICF framework. So how are we able to log, how is this person engaging in society? How is this person living in a healthy way? How is this person more functional? How are we measuring this? So how are we measuring the health and contribution and basically the living well of the person within society? So us contributing to this, we can talk about what we see in our offices every single day.
Right.
And we can speak about, well, can we add this piece of health? Can we measure this part of health? And can we add that as within the ICF coding system?
I love this. I mean, she came
Yeah.
all the way from Tampa to help us out here, and this is such an exciting conversation because I think, like everything, what doesn't grow dies. And as you're sitting here today, you're an actual reality check to, we're growing. We're starting to recognize that if we focus on one piece of it, we're missing the gamut of opportunity to change the world. And that's where I see the next layer of hope is that depending on where you are in the world, you're still gonna need the help to be able to function during the day. But how do we get away from just pain and move to gain, right? The preventative part. You know, I remember seeing, and maybe you will reflect on this, there was a video that was done by the World Spine, and it was showcasing exercises, and I'll never forget it. It was imprinted in my mind, and you may or may not remember this, but I saw a whole level, I believe it was in Africa. Do you recall this video?
We have a lot of videos
there's
from
a lot,
Africa.
it was a really beautifully done video, and you could see the gamut of the community coming together to really strengthen their core and understand what prevention means. And it touched me deeply because some of these people, they have to walk hours and hours just to get water. And you have back pain and you're walking hours in the hot sun. You're not providing for your community. And I think that's one of the things that really hits home is we need to do better, and we need to get them to have better, and functional movement is part of a critical component to true whole being care. That psychosocial factor that wraps around and embraces and lifts us up as a world, as a global health ecosystem. And where do you see now World Spine Day this year coming up? What are some of the things you're excited about?
I'm excited about all of the creative initiatives. Speaking about Africa, we have the Chiropractic Association of South Africa, and they are just always coming up with something new and different. And this last year, they did something called a baby box initiative. And so they basically tried to make these boxes for new mothers. So in Africa, these mothers, they have their baby and then they leave. They have nothing else to go with them. And so within the baby box, they had a small sheet of paper on showing how to make sure the baby has their spine correctly positioned, and how to care for the baby, how to put the baby in certain postures, how to care for themselves. And so, but it was also a handout that didn't have anything on it, because within Africa you have a lot of different languages. So they can't sit here and read something in English maybe because they have a spoken language that's different. So they were able to communicate to these new mothers how to be able to go and support health for themselves and their baby just from day one. And that's just one example. So I'm really looking forward to all of the really creative examples that I see. How can we, like you said, do better? How can we create awareness in all aspects of life on spinal health and if anything, prevention? And being proactive about just not having a condition that is pain, which is, as we know, the body's, what I call to my patients, the body's check engine light. Yeah. Tells us we got to address this now, but what if we addressed it before? So I love the awareness that comes with it.
Well, I'm going to transition us a little bit to local, which is a global situation, which is our veterans. And you're working in the VA right now.
Right.
I just had a nonprofit approved for vets, and my dad was a PJ, PTSD, ultimately died of alcoholism and cancer. And I see a lot of veterans that are going through struggles, buddies of mine that are like, hey, I want to get chiropractic. And let's go back 10 years. There wasn't a lot of chiropractic in the VA. Now we have it, right? It's growing. The integrative health up in Northern Virginia and everything that's coming around. Where are you seeing changes? And I love that you're bringing this function side in, right? Because when chiropractic initially got in, it was all about pain. And now with the integrative approach, we're changing that function. How do you see the veterans changing with chiropractic care right now with what you're seeing, and then where do you see it going?
I see them, they are phenomenally impressed with chiropractic. Some of them come in and they're like, I don't know why I'm here, you know. But then you have other who've been trying to get in forever because they found that they could have some form of non-pharmacologic way to address their pain. And then, and they were able to see that, oh, I identified this PTSD that we have here. You know what? Thinking about biopsychosocial, let's coordinate with the pain psychologist and let's work together, and me and the pain psychologist go and talk to each other down the hallway. We have the VA whole health approach, which I love. If you look at the VA circle of health, you can see that the center is me, the outside's the community, but all around me is not only just mobility and flexibility, it's having a healthy life, it's having a community, being mentally present and being settled in your space. And right now within the department, what we're going back and forth with the pain clinic, and we're trying to figure out an off-ramp type of situation. So as the pain clinic works with some of the patients, or as we work together to get them off of some of the pain modalities, then we can transition them into the whole health world, and they can stay active and be active and then come and visit me to just increase and keep their functionality. And I only see that growing in the VA system at this point.
How many chiropractors currently are in the VA system?
Oh my goodness. There were, at one point, I knew there was about 150 plus, but there's much more than that now.
Yeah.
So.
I think this is really close to my heart, right? My mom and dad, both military, my sister and beyond, and a lot of my friends. But for those watching, I think one of the things that we don't realize, and we talk about the world, but I want to make a very clear point here, is how much our veterans do for us and how much they haven't gotten over the years on this topic. And my mom's a huge fan of chiropractic, and she pushes it. And to finally see clinicians like you, close friends of mine that graduated with me that are now in the VA system, I'm just excited with where we're going for our vets. And I think and you and I always talk full body, nervous system, mind, body, soul. And to finally see my friends getting out of pain without pharmaceuticals and getting back to their life and getting back to being able to play and have a life and thrive. I think it's really amazing. It goes along with Spine Day. It goes along with what the WHO initiative is. And it truly is global. Like if we think about it, right? Like we're one beam, we're all one. Right. And the thing that I've always loved about chiropractic is that when there's no ego, all there is love. And if we have that and we can truly give that back to people who have been through, whether it is war or some type of traumatic event, chiropractic is a really good way to get started. Yeah. Can you talk about some, if you don't mind me asking this, because I think you're in it, right? Mm-hmm. Talk about some of the mental changes that you've seen through chiropractic inside the VA.
Oh my goodness, it's been phenomenal. I have had just the biggest, roughest Harley dudes come into my office being, very hard and everything. And by the end of the appointment, having them in tears. Mm-hmm. I mean, literally in tears, and you're just sitting here with your mouth open because this is what you do every day, And so you have some of those people who at the very beginning, they finally get an explanation for what they've been trying to address for how many years. And they've gone through so many injections and all of these things. And then all of a sudden they get this explanation that makes sense. And then they start seeing the changes. Yeah. And as I continue to see them, I'm able to talk with them more. So whereas some of them who might be one of those moments where they start crying, they express hope for the first time, and as we know, hope is a very big indicator within the big problem of suicide, right? Yeah. So, and a lot of these people come in and a lot of their depression has to do with, yes, PTSD and all this, but the pain is what's driving them insane. So when they come in and they express hope, when they see me, that this is the first time I felt hope in a while, that's when you know you're addressing something. And then you move forward and you see them again and, they come in, I know I'm gonna change my diet, blah, blah, blah. You start building rapport. And then all of a sudden, they sit there and they're telling you that, you listen to me. I can tell you care. And so they start listening, and when I'm listening to them, they start listening to me. And so all of a sudden I change their outlook on how to be healthy, how to move, how to be able to foster health. And so it goes from an instant mental change to a gradual mental change over time. And then one of the ones I just saw lately, I didn't want to come here, and I thought that you were going to hurt me and all this stuff. And he was like, but I actually really enjoy coming here now, and I cannot believe how much motion I got. I can play golf now for the first time and go all the holes without any pain. And so, yeah, it goes from instant to gradual over time.
I'll wait till after you.
This is one of those moments where first I want to say thank you to every man and woman that has served this beautiful country, as globally as we are, and we know there's people from Brazil. We know you're there. Thank you to the military, for all the men and women that are serving right now, our active duty military. We cannot function without you, so please know from the bottom of all of our hearts, we appreciate you. The veterans, we love you. We want to be able to help you. In Adjusted Reality, there's a spot where Dr. Wilks just noted that with hope is the ability to cope. And without the ability to cope, there is no hope. So it's a circle. And when you have one friend or one physician who will reach down and grab your hand and pull you up, that's the person you want to see, and keep going until you find that person. There is no stopping. We're with you. We're for you. This is all about you. And I think with Dr. Wilks being in the VA and on a global scale, it's so beautiful.
Amen. And I think the thing too, I want to do a follow-up question, because you're on the initiatives, you're on these panels. Is there opening for the family to start being seen in the VA system, not just the veterans themselves?
They're not at this point, but there has been lobbying to try to get chiropractic as part of TRICARE.
Yeah, that's one of my questions, right? Because I think it's so important. Like, I always make the joke with my pro athletes. I'm like, I really don't care about you. I care about your baby. You know what I mean? I want this next generation of kids, and I'm a TRICARE kid, right? Like, my mom was military, and TRICARE took care of me my whole life. But I do think that if we can get, especially like the wives and the husbands of our service members, right? Because they've gone through just as much trauma, and they're in just as much pain. And a lot of times they're carrying the weight when, my mom was deployed or on TDY. And I think it's so important that, and we have a public audience right now, and I want to say, if you're out there, reach out to your congressmen and senators and really push to have chiropractic put into the VA under TRICARE for these families. Because if we can start to, then we just create a pattern and an opportunity to change the world. And so I just want to commend you. I mean, this is and it's selfless, because you make less money than most chiropractors being a service member in the VA. And I want to say thank you.
Yes.
Because you could be making a heck of a lot more money, because it's not about the money for you, it's about making change. And, and when you serve in that capacity, I want you to know to be honored. And all the chiropractors that are out there, they're giving up having a clinic of their own where they could be making more money to serve our members. I think that's really amazing too. So I just want to say thank you.
Yes, absolutely.
Last word for you, Dr. Wilks, as you've touched so many lives, both in the VA and around the globe. What would you like to say to our consumers that are listening right now, from your experience, that perhaps they could either do take-home homework or just hear your voice in the World Spine and the VA world?
Like it's been referenced, there is always hope. Many people have been to many different providers, and maybe they went to a chiropractor at one point that they didn't work out well with, because we're all unique individuals. And so don't think that maybe just because I've tried a chiropractor at one point, don't think that you've tried all of chiropractic, because sometimes it just takes the right person in the right place to be able to hear you, to be able to work with you well. And so I would say definitely know that there is hope out there, and go and try to find the right person who is going to treat you, because in the end we are all people, and we want to make sure that we're matching with the right person who can work with us, who goes with us along that path to a life that is more healthy and is much more functional, and you're able to do what you want to do, how you want to do it, and when you want to do it.
Well said. Fantastic. Wow, this segment was actually very dear to me, knowing that we have people that are serving and people that have served. And so thank you from the bottom of our hearts. for you watching today, because this segment was not only informative, it was deeply touching to me to see the lives that have been impacted. And Dr. Wilks, you're amazing, and thank you so much for tuning in to see this segment.
Thank you again. And we'll be right back after this quick break, so stick around. Don't forget that you can still donate. We're almost to that $30,000, so if you can, hit donate, share, and you'll be entered in that raffle. Remember that for the Adjusted Reality Bundle. This is the perfect time to just take a break, take a deep breath, know that you're making the world a better place, and we'll be right back.